Okay.
What does the EMT training involve?
Emergency medical training.
What does it like involve? Like, does it involve like college course or something?
And it's a specialized training for that. It's not you don't go to college. You can take it out of college, but it's a special training for certification as an emergency medical technician.
Okay.
Okay, and most ambulance corps today have all their people with EMT certifications. It just goes beyond general first aid. And you have to learn all the bones in the body, and you're able to administer injections and that sort of thing.
Okay.
At the direction of the people at the hospital, which you're in communication with. Okay, but you're able to do more for the patient right on the spot and during the transport. But everybody involved in the ambulance corps has that same training, that same level. But the jobs that are required are, of course, somebody to drive the ambulance, and then there are other people to just attendants, they're called, just to take care of the patient. To assess what they need to do. That's called triage, and then to do it and then get them into the ambulance and transport them to the hospital.
So there was like a few people in the back that would help. That would help with the assisting the patients and doing certain things. But you also said that they were in communication with the hospital. Was that one of the specific jobs? Like, first, was somebody supposed to be in, like, was one of the person in contact with the hospital, or were all?
Well, it's both. There usually are two attendants, and they're with the patient. People with the patient are the people who are in touch with the hospital because they're monitoring the signs, the blood pressure and things like that, breathing, and in touch with the hospital. The hospital will tell them what to do, given, what happens with the patient, until they get them in there for treatment by an MD.
Okay. Which is a doctor, right?
Yes, yes.
What was your job?
My job, I was an attendant. I attended the patients.
Okay.
Yeah.
How about, in what ways has, like, this line of volunteer work been carried on by the ambulance corps, and, like, what have you gotten from it as well?
Well, I mentioned before that you learn a lot. Okay, that's one of the benefits of volunteering. And what you learn, the training that you get in terms of taking care of injuries and such, is really not forgotten. Maybe some people would forget. I didn't forget. And I have, after leaving the ambulance corps, I stopped at many accidents and such to render first aid before anyone else got there, while waiting for the ambulance to come. Most recently, this summer, actually, I was on my way to go to do some grocery shopping, and I came upon an accident where a woman had fallen off a motorcycle. She was driving a motorcycle and it tipped over, and she was very seriously injured. In fact, she had to be, and I waited with her with some other people, and other people there didn't really quite know what to do. But she had some serious head injuries, had to be medevaced out of there. But I stayed there until the ambulance personnel got there, and then they took over. So. That's always a good thing to do. Because if somebody's bleeding or something, you want to be able to stop that real quickly, or if they cannot breathe, you want to get them breathing right away.
So the training, like, not only does it benefit the society when you're in the ambulance corps, it keeps on going. Like, it benefits society because you have the knowledge and you're able to help whenever you can.
Yeah, and that's true of anything. I mean, if you are volunteering at the fire company, you could probably put out a fire, or at least you would know what to do in terms of getting people to safety and that sort of thing. There are things that you learn that you would remember. If you're volunteering at the animal shelter, you would learn things about the care of animals, what to do, what not to do, and how to handle, how to talk to people about it. Maybe even how to calm them down or help them to understand what's happening. So it stays with you.
How have you been affected emotionally? Like, what has it done to you?
Like, what's your attitude towards?
Yeah.
Emotionally? Well, I'm very happy to be interviewed about it. I hope that you guys will volunteer for something soon. I feel very good about it. Obviously, I'm still doing a lot of volunteering. So I really think sometimes we all are in pretty much of a time crunch. And sometimes you think, I have another meeting to go to or something like that. But once you get there, you realize that it was definitely worthwhile, and it doesn't really take that much away from you. It gives more than you have to, that it takes from you. And as I said before, it just feels, you feel connected, you feel aware of what's going on, and you really feel like you're contributing. I mean, I guess if you wanted to be a hermit and hide out in a cabin or a cave somewhere in the wilderness, that wouldn't matter too much to you. But I still think that people need to interact, and they need to be, man is a social animal, and we need to feel that we're part of a group. Not a herd necessarily, but a group. And it really keeps you in contact, not just in contact with the group like going to a party or something, but actually helping the group to do something.
Thank you very much.
Thank you. And go out and volunteer.